evening, Mr. Kiphart. How are you?
Good.
Good. My name is Allie. I'm your student nurse today. I'm just here to do a quick head-to-toe assessment. It's probably gonna take me about 20 minutes. Do you need anything before we get started?
Nope.
Are you in any pain?
Nope.
Okay, good. I'm just gonna provide privacy and wash my hands. Can you tell me your name and date of birth?
Travis Kiphart, April 18th, 1999.
Okay, good. If you don't mind, I'm just gonna check your bracelet, make sure that matches. Yes, it does. Good. Okay. Well, your bed is in low lock position and there's no IVs or wires hanging around. You seem to be alert and awake. Your hair is well brushed. The floor is clear and there's a clear pathway to the bathroom. So you don't seem to be in any distress and you're overall safe, so that's good. I'm just gonna start off with your head if that's okay. Do you have anything to report about your head before I start? Okay, good. Just gonna check your scalp here for any lacerations or lesions or bruising or bumps. Your hair is thick and soft and clean. That's good. I'm not seeing any signs so far. Good. Okay, if you just want to lean forward, I'll do your back. No balding back here, and the hair is still pretty thick, so that's good. Put that back the way it goes. Okay, I'm just going to check your temporal pulse really quick. Good. Those are 2+ strength bilateral. And then your skin is warm to the touch. And the color is true to ethnicity. So I'm going to go ahead and look at your ears. Do you have anything about your ears I should know about?
Nope.
Okay, there's no excess earwax. No lesions. Checking here. Okay, good. Now I'm going to check your pupillary response. I'm going to shine this light in your eye about 4 times. I just need you to open wide and look straight ahead for me, okay? Okay, good. Now follow this for me. Good. Pupils are equal, round, reactive, and accommodating to light, and there was consensual response. I'm going to go ahead and check in your nose for me. Any troubles breathing out of your nose?
No.
Okay, good. Mucous membranes are pink and dry. Go ahead and open your mouth wide for me. Let me check under your tongue. Good. Let me check your lips. Okay. Doesn't seem to be any lesions or sores or lacerations inside the mouth or around the cheeks. Gums are clear and your teeth are real, correct? Okay, good. I'm going to go ahead and check your carotid pulse. Okay, and I'm going to go ahead and check over here. And that's 2+ strength bilateral, so that's good. I'm gonna move on to your chest assessment now. Do you have any complaints about your chest? No pain?
Nope.
Okay, good. Chest wall is symmetrical. There's no signs of any labored breathing. I'm gonna go ahead and pull up your shirt. Just a hair. Thank you, thank you. Okay, the skin is warm to touch and it's true to, the color is true to ethnicity. I'm going to go ahead and listen to your breath sounds now. So I'm going to start up here at your trachea, and these are bronchial sounds. Inspiration is shorter than expiration, and the sound is going to be very high pitched. So go ahead and take a deep breath. Good. Check over here. Okay, good. I'm going to start at your second intercostal space. And these are bronchovesicular sounds. And that is inspiration is equal to expiration. And these are gonna be medium sounds. So go ahead and take a deep breath. Deep breath. Okay, gonna move to the fourth intercostal space. These are vesicular sounds. Inspiration is longer than expiration, and these are very soft sounds. Deep breath. Deep breath. Okay, moving on to the fifth intercostal space. These are still vesicular sounds. Deep breath. Deep breath. Okay, and I'm down here at the sixth intercostal space. Deep breath. Still vesicular sounds. Deep breath. Okay, and now I'm going to be checking your mid-axillary. So deep breath. Deep breath. Good. I'm gonna have you sit up for me for just a minute, and I'm gonna check your posterior. Lean forward for me, and I'm gonna start here at C7, and these are vesicular sounds. Okay, I'm gonna move to T4. Move into T6. Deep breath. And then we're down to T8. Deep breath. Okay. Good. No evidence of wheezing or stridor. And while I have you like this, I'm just going to assess your spine for any scoliosis, lordosis, or kyphosis. Your spine is straight, so no evidence of that as well. I'm gonna have you lay back down for me. And then I'm just gonna check your arms and palpate for edema. Okay, no pitting. And no pitting bilaterally. I'm gonna check your capillary refills. Capillary refills are brisk on both sides. I'm going to check your brachial pulse, so hold your arms out like this for me. Those are 2+ strength bilaterally, and then I'm going to check your radial pulse as well. Hold that out for me, thank you. Two plus strength as well. I'm gonna have you keep your eyes closed really quick, and I just want you to tell me where you feel the sensation on your arms, okay?
Bottom right. left hand, top right.
Okay, good. And then I'm gonna check your skin turgor. Okay, brisk response bilaterally. And then now I'm just gonna do your vital signs really quick. So normal range for blood pressure is 120/80, and normal range for your pulse would be 60 to 100 beats per minute. And normal range for respirations is 12 to 20 breaths per minute. And normal temperature for a patient under 65 would be 96.8 to 100.4, and a patient over 65 would be 96.8 to 98.3. Okay? I'm gonna move on to your abdomen now. I'm gonna ask again, are you in any pain?
No.
Okay. And then I'm just gonna lift your shirt up just a little bit this time, if that's okay. Okay. The contour is symmetrical, no signs of labored breathing. The umbilicus is centered. The skin is warm to touch, and the color is true to ethnicity. So I'm just gonna go ahead and listen to your bowel sounds. Bowel sounds are active in all 4 quadrants. The normal range would be 5 to 35 sounds per minute. Below 5 would be hypoactive, and above 35 would be hyperactive. Now I'm going to go ahead and listen to your vascular sounds with the bell of my stethoscope. I'm going to start with the aorta, which is 2 inches above the umbilicus. So right about here. Okay. Now I'm gonna listen to your renal arteries, which is above the umbilicus laterally. And the iliac arteries, ileum. Okay, good. No signs of bruise. Now I'm just going to palpate your abdomen. Abdomen was soft to palpation, no distension. Okay, and then I'm just gonna locate your femoral artery, which is midway between the pubic bone and the iliac crest. And I'm just gonna move on down here to your legs right now, okay? So I'm gonna palpate for edema, no pitting, good. I'm going to check your popliteal pulse, so if you could just lift your legs just a teeny bit, thank you. Good, those are 2+ strength bilateral. I'm gonna check your posterior tibialis pulse. Those are 2+ strength bilateral. And then I'm gonna check your dorsalis pedis pulse. Those are 2+ strength bilateral as well. I'm gonna check your capillary refills in your toes. Those are brisk bilaterally as well. One more time, I'm gonna check your sensory perception, so just keep your eyes closed. Let me know where you feel.
Left leg, top right leg, left foot.
Good. And the temperature is warm to touch. Skin's color is true to ethnicity. And then while I've got you laying like this, I'm just gonna have you lift up your legs while I push down, okay? Check your strength. Good job. Okay, now I'm gonna have you go ahead and sit up. Okay, and I'm gonna push down on your shoulders, and you're gonna push up. Okay. Good. And then go ahead and copy what I do. And you go like this with your neck. You go like this. You look this way. Look that way. Good. Can you go like this? Good job. Can you go like this? Perfect. Can you go like this? And this? Okay, how about this? Good, you can put your call right down, that's okay. Thank you. Okay, I'm gonna hold out my fingers, give me a nice tight squeeze on my fingers. Good job. Okay, and then hold out your palms like this. I want you to push towards me and I'm gonna push back. Good job. Hold them out. I'm gonna pull. I want you to pull towards yourself. Good. Okay. And then I'm gonna push back towards you and you're gonna push out towards me on your calves, okay? Good job. And then I'm gonna pull out and you're gonna push back. Good. I'm gonna have you stand up, please. And then I'm just gonna have you walk to the wall. Okay, good gait. The posture is straight. The head is above the shoulders. Shoulders are above hips. Hips are above knees and knees are above feet. There's no limping in the gait and arms are walking freely next to each other. I'm gonna have you go like this. And like this. You can go like this. And like this. Okay, good job. You can lay back down in your bed now. You have good endurance, good strength, strength times 5. Okay, I think I'm just about done here. Did you need anything else? Are you in any pain? Okay, here's your call light. I'm gonna put the bed back down on low. Pull the curtain and wash my hands again. Okay. All right, we're all done. And then I forgot to do the apical pulse, and I forgot to do the alert and oriented times 4, and that is all. Okay, now you can